My name is Lucy Musset and I'm the Patient Safety Lead for developing the new digital system to support patient safety learning. We are creating a new incident management system because we have a unique opportunity at this moment in time to capitalise upon the technology that is available and the groundswell of motivation and support around improving patient safety and supporting providers to provide better care for their patients. We are replacing outdated technology with something that is infinitely newer, better, more flexible, more accessible, more transparent, and ultimately is much more focused on providing the kind of learning that we want to get out of this. The new system is going to offer a lot more compared to the previous systems in a lot of different ways. So from the frontline staff perspective, it should be much easier to access and to report that information in the first place. We're capturing a completely new and experimental data set to see if it can make us much more focused on learning, less about counting and more about trying to understand exactly how things go wrong so that we can identify new ways to tackle them. We're going to make the data much more accessible and transparent, so not only can we as a national team derive much more insight and value from it, but the whole of the NHS should be able to get much easier access to that data and undertake analyses for themselves, the kinds of topics that are interesting and important to them. And we're going to try and provide much better and more targeted feedback to people so that the whole process of participating and taking time away from your patients to input that data in the first place feels much more rewarding and much more relevant, and that you get to actually see some tangible benefit out of it as an individual or as an organisation. But also we're looking to include machine learning tools and natural language processing software to help filter through the free text fields that we receive, for example. So our clinical team who undertake the national clinical review and sort of surveillance work of the data that we receive currently, they focus very, very heavily on that unstructured text because that's where you get the story of what's happened. That's where your frontline staff is saying, this is the thing that I have just witnessed or experienced. And you can't really categorise all of that necessarily. And that's where they get a feel for what the atmosphere was like and what the conditions were and how upset that person was. One of the things that has loads of potential and we want to explore a lot more is the capacity for using artificial intelligence to scan all of that information and start showing us the records that we might need to see. So at the moment they are cut by kind of severity of harm, so we look at the severe harm and death incidents first, which is right and proper given the tools that we have. But if we're able to support a more nuanced and intelligent way of processing that data, it might be that it starts to show us things that we would never have got around to looking at previously. Because of the way that the old system was set up 15 years ago, it really only works if you're in a hospital. One of the benefits of the new system is that we're designing it so that it will continue to work really well if you're in a hospital and you won't have to make huge changes or buy loads of new software. But if you're a dentist or a GP or an optometrist or a community midwife out and about, this system is designed to work for people who don't have a load of infrastructure locally. You can do it from your mobile phone, and it's designed to support you to do what you need to do quickly and easily without needing loads of kit to support it. It gives us the opportunity to shine a light on huge chunks of healthcare that for a long time have kind of been in the dark because they just haven't had the tools to tell us the stuff that they need to tell us about the safety of their services. So the new system is not only about updating the technology, but it's about creating something that fits with the kind of patient safety culture that we want to see now, about putting the patients at the heart of what we're doing, about being very much focused on learning, about removing anything that tries to create a culture of blame and makes it much easier for people to be candid about the things that we really need them to tell us. Because until people feel safe and supported to be honest about the things that are happening within their organisations, there's no way that we can come to understand those and help support change to improve them. So it's really important that while an IT system can't create a culture, it can be designed in a way that supports that safety culture and enables the right kinds of behaviours so that we can all come together and keep the focus on the patient and how we can support and improve things for them.